Across New Jersey, physicians say they're already seeing an uptick in cardiac emergency cases linked to heavy snow and strenuous shoveling. With snow very much still a part of our lives this week in the tri-state region, medical professionals are warning that it takes only 20 minutes in the cold to raise your blood pressure. Megan Stefik has more from Old Bridge.
Medical officials across the country are reporting that many patients come into the emergency room because of heart attacks or cardiac arrest while shoveling snow. Doctors at Old Bridge Medical Center say they've been seeing an uptick in cardiac cases in the days following the storm. They say the strain of cold exposure and heavy lifting are key factors. Dr. Patrick Rogers is the vice chairman and assistant medical director of emergency medicine at Old Bridge Medical Center. He explains the physiologic changes that occur in the cold.
Well, typically in colder weather, what happens is our blood vessels will constrict and they'll clamp down, and this causes an increase in blood pressure within 20 minutes of cold exposure. So what actually happens is the heart is actually pumping against more resistance, so it actually is causing the heart to work harder in these colder temperatures.
Doctors say preparation matters. They recommend stretching and hydrating before heading outside, dressing in layers, and starting with smaller, lighter loads instead of tackling the entire driveway at once. They also warn against drinking alcohol before and after shoveling, which can create a false sense of warmth and mask early warning signs.
When we typically lift a heavy load, it's human nature to hold our breath, and such as lifting a heavy snow shovel, we would hold our breath, and this would cause a disproportionate rise in blood pressure and heart rate, causing an extra tax on the heart and making it increasingly stressful.
Health officials say some individuals of the vulnerable population shouldn't be out here shoveling at all, especially older adults and those with underlying health conditions, including heart disease, high blood pressure, and diabetes. Doctors say pacing yourself is critical. If you shovel for 20 minutes, they recommend taking a break for 30 to 60 minutes, sitting down and allowing your body to fully recover. They stress the importance of listening to your body during periods of physical strain, especially in freezing temperatures.
So concerning symptoms that people may experience while shoveling snow that may be indicative of a cardiovascular event include chest pain, shortness of breath, dizziness, excessive fatigue, excessive sweating, or nausea.
Doctors are also reminding residents that staying connected to watch over one another is key to staying safe. And it's always a good idea to check on loved ones and elderly neighbors frequently, and especially after a storm. Reporting for WMBC Hometown News, I'm Megan Stefik.